All right, Taggart notes, embalming, glossary. I'm going to read straight through these. It's about 14 pages, so it's probably going to be a little over an hour. Abdominal anatomical regions. 9-region plan by means of tour imaginary planes. I think that means 4, by means of 4 imaginary planes, 2 of which are horizontal, indicated by lines drawn across the right and left 10th ribs and across the right and left anterior, superior, iliac spines, and 2 sagittal, indicated by lines drawn from midpoint of inguinal ligament to nipples of chest, right and left sides. Upper row. Right hypochondriac, epigastric, left hypochondriac. Middle row, right lateral, umbilical, left lateral. Lower row, right inguinal, pubic, left inguinal. The 4-region plan by means of 2 imaginary planes, 1 horizontal and the other mid-sagittal. The upper right quadrant is, upper right quadrant, upper left quadrant, lower right quadrant, lower left quadrant. That was written so shitty. Probably just have to draw that out. Okay, so an abrasion, antemortem injuries resulting from friction of the skin against a firm object resulting in removal of the epidermis. Abut, A-B-U-T, to touch or contact, as with the tarsal plates of the closed eyelids. That is abut. Accessory chemical is a group of chemicals used in addition to vascular, arterial, and cavity embalming fluids. Includes, but is not limited to, hardening compounds, preservative powders, sealing agents, mold preventative agents, and PAC application agents. Acquired immune deficiency syndrome. AIDS is a specific group of diseases or conditions which are indicative of severe immunosuppression related to infection with the human immunodeficiency virus, HIV. Persons dead having AIDS may exhibit conditions such as wasting syndrome, extrapulmonary tuberculosis, and Kaposi's sarcoma. Action level. AL exposure limits. These are levels established to ensure adequate protection of employees at exposures below the OSHA limits, but to minimize the compliance burdens for employers whose employees have exposures below the 8-hour permissible exposure time limit, PEL. The AL for formaldehyde is 0.5 parts per million ppm. Actual pressure is that pressure which is indicated by the injector gauge needle when the arterial tube is open and the arterial solution is flowing into the body. Actual pressure. Adipocere, also called grave wax, is soft, whitish, crumbly, or greasy material that forms upon the post-mortem hydrolysis and hydrogenation of body fats. Aerobic means in the presence of oxygen. Aerosolization is to disperse as an aerosol. Minute particles of blood and water become atomized and suspended in the air when water under pressure meets the blood drainage or when flushing an uncovered flush sink. Agglutination is intravascular. It is the increase of viscosity of blood brought about by the clumping of particulate formed elements in the blood vessels. Agonal algor is decrease in body temperature immediately before death. Agonal coagulation is in reference to blood, a change from a fluid into a thickened mass. Agonal dehydration is the loss of moisture from the living body during the agonal state. Agonal edema is the escape of blood serum from an intravascular to an extravascular location immediately before death. Agonal fever is the increase in body temperature immediately before death. Agonal period is the period immediately before somatic death. Agonal period. Agonal translocation. See translocation, so we'll get to that later. Algor mortis is the post-mortem cooling of the body to the surrounding temperature. So agonal algor is decrease in body temperature immediately before death. Algor mortis is post-mortem cooling of the body to the surrounding temperature. Alternate drainage is a method of injection drainage in which the embalming solution is injected and then injection is stopped while the drainage is open. Amino acid, that's the building blocks of which proteins are constructed and the end products of protein digestion or hydrolysis. Their basic formula is NH2CHR-COOH. The COOH that kind of stands out on the end is an amino group, an alpha carbon, and any aliphatic or aromatic radical, and a carboxyl group. Anaerobic means in the absence of free oxygen. Anasarca is severe generalized edema. An anatomical guide is a descriptive reference for locating arteries and veins by means of anatomical structures which are known. Anatomical limits are points of origin and points of termination in relation to adjacent structures, used to designate the boundaries of arteries. Anatomical position. The body is erect, feet together, palms facing forward, and thumbs are pointed away from the body. Aneurysm is a localized abnormal dilation or outpocketing of a blood vessel resulting from a congenital defect or a weakness of the vessel wall. Aneurysm hook is an embalming instrument that is used for blunt dissection and in raising vessels. Aneurysm needle is an embalming instrument that is used for blunt dissection and in raising vessels, which has an eye in the hook portion of the instrument for placing ligatures around the vessels. So the only difference between an aneurysm hook and an aneurysm needle is the needle has the eye. Angular spring forceps are a multi-purpose instrument used in the embalming process. Anomalies is a word for deviation from the normal. Antecubital Antecubital means in front of the elbow or in the bend of the elbow. Antemortem is before death. Anterior means towards the front. Anterior superior iliac spine is a bony protuberance which can be palpated topographically, found on the ilium, the superior broad portion of the hip bone, the original of the inguinal ligament and the sartorius muscle is the anterior superior iliac spine. Anticoagulant fluid is an ingredient of the embalming fluids that retards the natural post-mortem tendency of blood to become more viscous or prevents adverse reactions between blood and other embalming chemicals. Apparent death is a condition in which the manifestations of life are feebly maintained. Apparent death, like death has become apparent. Not there yet, but it's apparent. Arterial vascular fluid, the concentrated preservative embalming chemical that will be diluted with water to form the arterial solution for injection into the arterial system during vascular embalming. The purpose is for inactivating saprophytic bacteria and rendering the body tissues less susceptible to decomposition. Arterial solution, the mixture of arterial vascular fluid and water, which is used for the arterial injection and may include supplemental fluids. Arterial tube, a tube used to inject embalming fluid into the blood vascular system. Arteriosclerosis, the term applied to a number of pathological conditions causing a thickening, hardening, and loss of elasticity of the walls of the arteries. Articulation is a place of union between two or more bones. A place of union between two or more bones. Ascites or ascites, accumulation of serous fluids in the peritoneal cavity. Asepsis, freedom from infection and from any form of life. Sterility. It's sterile, asepsis. Asphyxia is insufficient intake of oxygen resulting from numerous causes. Aspiration is withdrawal of gas, fluids, and semisolids from body cavities and hollow viscera by means of suction with an aspirator and a trocar. Atheroma is fatty degeneration or thickening of the walls of the larger arteries occurring in atherosclerosis. Atheroma. Autoclave. Apparatus used for sterilization by steam pressure, usually at 250 degrees Fahrenheit, 121 degrees Celsius for a specific time. Autolysis. Autolysis is self-destruction of cells, decomposition of all tissues by enzymes of their own formation without any microbial assistance. Autopsy, a post-mortem examination of the organs and tissues of a body to determine cause of death or pathological condition. A necropsy. Bactericidal agent is destructive to bacteria. Bacteriostatic agent is an agent that has the ability to inhibit or retard bacterial growth. No destruction of viability of the microorganism is implied. Balsamic substances are resins combined with oil, a fragrant, resinous, oily exudate from various trees and plants. Is a balsamic substance. Base of the axillary space means the armpit. The anterior boundary of the base of the axillary space is established by drawing a line along the fold of skin which envelops the lateral border of the pectoral major muscle. The posterior boundary is established by drawing a line along the fold of skin which envelops the lateral border of the latimus dorsi muscle. The medial boundary is established by drawing a line which connects the 2 points where the pectoralis major and the latimus dorsi muscles blend into the chest wall. The lateral boundary is established by drawing a line which connects the 2 points where the pectoralis major and the latimus dorsi muscles blend into the arm. Bilirubin is the yellow breakdown of product of normal hemicatabolism. Hemi is from hemoglobin, and it's a principal component of red blood cells. Bilirubin is excreted in bile and urine. It is responsible for the yellow color of bruises, straw yellow color of urine, and the yellow discoloration of jaundice. Note, jaundice is not a disease, but a sign of a disease involving the liver. Biliverdin is a green tetrapyrrolic bile pigment and is a product of hemicatabolism. It is the pigment responsible for the greenish color sometimes seen in bruises. Formaldehyde will convert bilirubin to biliverdin in a jaundice case. So bilirubin with an R is yellow. Biliverdin with a V like Victor is green. Bischloromethyl ether or BCME, bischloromethyl ether, is a carcinogen potentially produced when formaldehyde, in other words, embalming fluid, and sodium hypochlorite, which is household bleach, come into contact with each other. Normally occurs only in a controlled laboratory setting and requires a catalyst. Biohazard is a biological agent or condition that constitutes a hazard to humans. Biological death is irreversible somatic death. A bleaching agent is a chemical which lightens a skin discoloration. Blood is a tissue that circulates through the vascular system and is composed of approximately 22% solids and 78% water. Blood is considered a tissue that circulates through the vascular system and is composed of approximately 22% solids and 78% water. Blood pressure is the pressure exerted by the blood in the living body on the arterial wall, measured in millimeters of mercury. Bloodborne pathogen rule. OSHA regulation 29 CFR something something, regulating the employee's exposure to blood and other bodily fluids. OSHA definitions includes blood, human blood components, and products made from human blood. Bloodborne pathogens, pathogenic microorganisms that are present in the human blood and can cause disease in humans. These pathogens include, but are not limited to, hepatitis B virus, HBV, and human immunodeficiency virus, HIV. Blood discoloration is discolorations resulting from changes in blood composition, content, or location, either intravascularly or extravascularly. Blood vascular system is the circulatory network composed of the heart, arteries, arterioles, capillaries, venules, and veins. Bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans. Blunt dissection. This is the separation and pushing aside of the superficial fascia, leading to blood vessels, and then the deep fascia surrounding blood vessels. Utilizing manual techniques or round-ended instruments which separate rather than cut the protective tissues. A boil. A boil is an acute, deep-seated inflammation in the skin, which usually begins as a subcutaneous swelling in a hair follicle. Bridge suture is also called a temporary interrupted suture. It's an individual stitch knotted at the tissue edge, may be applied prior to embalming to align tissues. Buccal cavity is a vestibule of the oral cavity, the space between the lips, gums, and teeth. Bulb syringe is self-contained soft rubber manual pump designed to create pressure to deliver fluid as it passes through one-way valves located within the bulb. It is used only to deliver fluids. It cannot be used for aspiration. Buffers. An embalming chemical which affects the stabilization of the acid-base pH balance within embalming solutions and in the embalmed tissues. Cadaver. Dead human body used for medical purposes, including transplantation, anatomical dissection, and study. Cadaveric lividity is the same as livor mortis, and we'll get to that. Cadaveric spasm is a prolongation of the last violent contraction of the muscles into the rigidity of death. Calvarium is the dome-like superior portion of the cranium. It's that portion removed during cranial autopsy. Calvarium clamp is a device used as a means of fastening the calvarium after a cranial autopsy. Canalization is Formation of new channels in a tissue. Capillaries are minute blood vessels, the walls of which comprise a single layer of endothelial cells. Capillaries connect the smallest arteries, arterioles, with the smallest veins, venules, and are where pressure filtration occurs in the capillaries. Capillary permeability is the ability of substances to diffuse through the capillary walls into the tissue spaces. Carbohydrates is a compound of hydrogen, carbon, and oxygen, sugars, starches, and glycogen. A carbuncle is a circumscribed inflammation of the skin and deeper tissues that ends in suppuration. That's not separation. I don't know what the fuck this is. Suppuration. Suppuration. Carbuncle. Like you're having supper, but it's suppuration, and is accompanied by systemic symptoms such as fever and leukocytosis. So carbuncles are bad. Carcinogen, a cancer-causing chemical or material. Cavitation, the formation of cavities in an organ or tissue frequently seen in some forms of tuberculosis. Cavity embalming, direct treatment other than vascular arterial injection of the contents of the body cavities and the lumina of the hollow viscera, usually accomplished by aspiration and injection. Cavity fluid, embalming chemicals which are injected into the cavities of the body following the aspiration in cavity embalming. Cavity fluid can also be used as the chemical in hypodermic and surface embalming. Cellular death, death of the individual cells of a body. Center of fluid distribution, ascending and or arch of aorta. That sounds important because that's fucked me up before. The center of fluid distribution is the ascending aorta or the arch of aorta. The arch of aorta or the ascending aorta is the center of fluid distribution. The center of venous drainage is the right atrium of the heart. A centrifugal force machine is an embalming machine that uses an electrical pump to create pressure, either pulsating or non-pulsating. Center for Disease Control and Prevention, CDCP or CDC. It's also CDCP. A major agency of the Department of Health and Human Services with headquarters in Atlanta, Georgia, concerned with all phases of control of communicable vector-borne and occupational diseases. Chelate. Chelate means substances that bind metallic ions such as EDTA, ethylene-diamine-tetracetic acid. You'll just have to look at that one, the long word for EDTA, because fuck that. Okay, so it's used as an anticoagulant in embalming solutions. EDTA, anticoagulant in embalming solutions, and also substances that bind metallic ions. And chelate. Bind metallic ions and chelate. Chemical post-mortem change is a change in the body's chemical composition that occurs after death such as hemolysis. Chemotherapy is the application of chemical reagents in the treatment of disease in man, causing an elevated preservation demand. Clinical death is a phase of somatic death lasting from 5 to 6 minutes in which life may be restored. Clinical death is a phase, 5 to 6 minutes in which life may be restored. Coagulating agents are chemicals and physical agents that bring about coagulation. Coagulation is the process of converting soluble protein to insoluble protein by heating or contact with a chemical such as an alcohol or an aldehyde. The solidification of a sol or solution into a gelatinous mass is also called coagulation. Agglutination is a specific form of coagulation. Co-injection fluid is a fluid used primarily to supplement and enhance the action of vascular arterial solutions. A coma is the irreversible cessation of brain activity and loss of consciousness. Death beginning at the brain. Okay. Communicable disease is a disease that may be transmitted either directly or indirectly between individuals by an infectious agent. Concurrent disinfection is disinfection practices carried out during the embalming process. Concurrent drainage is a method of drainage in which drainage occurs continuously during vascular arterial injection. Condyle, rounded articular process on a bone. Congealing, see coagulation and agglutination. Conjunctiva is a mucous membrane that lines the eyelid and covers the white portion of the eye. Conjunctiva. Contagious disease, disease that may be transmitted between individuals with reference to the organism that causes a disease. Contaminated, the presence or the reasonably anticipated presence of blood or other potentially infectious materials on an item or surface. Contaminated laundry is laundry which may have been soiled with blood or other potentially infectious materials, or may contain sharps. Contaminated laundry is also laundry that may contain sharps. Cornea is the transparent part of the tunic of the eyeball that covers the iris and pupil and admits light into the interior. Corneal sclera button is that portion of the cornea recovered for transplantation in situ. Coroner is an official of a local community who holds inquests concerning sudden, violent, and unexplained deaths. Corpulence is obesity, having an abnormal amount of fat on the body. Cosmetic fluid is embalming fluid that contains dyes and coloring agents intended to restore a more natural skin tone through the embalming process. Counter-staining compound, dye that helps to cover internal discolorations such as jaundice. Coverall, plastic garment designed to cover the body from the chest down to the upper thigh. Cranial embalming is a method used to embalm the contents of the cranial cavity through aspiration and injection of the cranial chamber by passage of a trocar through the cribriform plate. Cremated remains are those elements remaining after cremation of a dead human body. Crepitation is the crackling sensation produced when gases trapped in the tissues are palpated, as in subcutaneous emphysema. Creutzfeldt-Jakob disease is a disease of the central nervous system with unknown etiology, assumed to be a slow virus. Because of unknown etiology, caregivers using invasive procedures use extreme caution. Cribriform plate is the thin medial portion of the ethmoid bone of the skull. Death, irreversible cessation of all vital functions, and that's the non-legal definition. Death rattle. Oh. Noise made by a moribund person caused by air passing through a residue of mucus in the trachea and posterior oral cavity. Death struggle is the semi-convulsive twitches which often occur before death. Decay, decomposition of proteins by enzymes of aerobic bacteria. Decomposition, separation of compounds into simpler substances by the action of microbial and or autolytic enzymes. Dehydration, loss of moisture from body tissue, which may occur antemortem or postmortem. Antemortem is with febrile diseases, diarrhea, or emesis. Postmortem is like injection of embalming solution or through absorption by the air. Denatured protein is a protein whose structure has been changed by physical or chemical agents. Desiccation. Desiccation is the process of drying out. Desquamation, skin slip, is the sloughing off of the epidermis, whereas there is a separation of the epidermis from the underlying dermis. Dialysis, separation of substances in solution by difference in rates of diffusion through a semi-permeable membrane. Differential pressure is the difference between potential and actual pressure. Diffusion is the movement of molecules or other particles in solution from an area of greater concentration to an area of lesser concentration until uniform concentration is reached. Diffusion of fluid is the passage of some components of the injected embalming solution from an intravascular to an extravascular location. The movement of embalming solution from the capillaries into the interstitial fluids. Digits is the anatomical term describing fingers and toes. The thumb is number 1 for each hand, and the large toe is number 1 for each foot. Discoloration is any abnormal color in or upon the human body. Disease is any deviation from or interruption of the normal structure or function of a body, part, organ, or system. Disinfectant is an agent, usually chemical, applied to inanimate objects or surfaces to destroy disease-causing microbial agents, but usually not bacterial spores. Disinfection is the destruction and or inhibition of most pathogenic organisms and their products in or on the body. Distribution, fluid, the movement of embalming solutions from the point of injection throughout the arterial system and into the capillaries. Drain tube, tubular instrument of varying diameter and shape, preferably with a plunger, which is inserted into a vein to aid in drainage of blood and to restrict the exit of vascular embalming fluid. Drainage, discharge, or withdrawal of blood, interstitial fluid, and embalming fluids from the body during vascular embalming, usually removed through a vein of the body. Drench shower. OSHA required safety device for the release of copious amounts of water in a short time. Dry gangrene is a condition that results when the body part that dies had little blood and remains aseptic, and occurs when the arteries but not the veins are obstructed. Dye or coloring agent is substances which will, upon being dissolved, impart a definite color to the embalming solution. Dyes are classified as to their capacity to permanently impart color to the tissues of the body in which they are injected. Ecchymosis is extravasation of blood into a tissue, a bruise. Ecchymosis is just a fucking bruise. Extravasation of blood into the tissue. Electrocardiogram. ECG or EKG. Electrocardiogram is a record of the electrical activity of the heart. Edema is abnormal accumulation of fluids in tissue or body cavities. Electroencephalogram, EEG, is a record of the electrical activity of the brain. Electric aspirator is a device that uses a motor to create suction for the purpose of aspiration. Electric spatula is an electrically heated blade which may be used to dry moist tissue reduce swollen tissue, and restore contour. Embalming is the process of chemically treating the dead human body to reduce the presence and growth of microorganisms, to temporarily inhibit organic decomposition, and to restore an acceptable physical appearance. There are 4 types of embalming. Cavity embalming, direct treatment other than vascular arterial embalming of the contents of the body cavities and lumina of the hollow viscera, usually accomplished by aspiration and then injection of chemicals using a trocar. Hypodermic embalming is injection of embalming chemicals directly into the tissues through the use of a syringe and a needle or a trocar. Surface embalming is the direct contact of internal or external body tissues with embalming chemicals. Vascular embalming is the use of the vascular system of the body for preservation, disinfection, and restoration, usually accomplished through injection of embalming solutions into the arteries and drainage from the veins. Embalming analysis or case analysis is that consideration given to the dead body prior to, during, and after the embalming procedure is completed. Documentation is recommended. Engineering controls are procedures that isolate or remove the bloodborne pathogen hazard from the workplace, such as sharps disposal containers and self-sheathing needles. Environment is the surroundings, conditions, or influences that affect an organism or the cells within an organism. Environmental Protection Agency, EPA, is a governmental agency with environmental protection, regulatory, and enforcement authority. Enzyme is an organic catalyst produced by living cells and capable of autolytic decomposition. Excision is to remove as by cutting out the area from which something has been cut out. Expert tests of death is any procedure used to prove a sign of death, usually performed by a medical professional or medical personnel. Exposure incident is a specific eye, mouth, or other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials that results from the performance of an employee's duties. Extravascular, outside the blood vascular system. Extravascular blood discoloration is discoloration of the body outside the blood vascular system. For example, ecchymosis, petechia, hematoma, and post-mortem stain are extravascular blood discolorations. Extrinsic means from outside of the body. Eye enucleation is the removal of the eye for tissue transplantation, research, and education. Eye enucleation, discoloration, is the extravasation of blood as a result of eye enucleation. Eye wash station is an OSHA-required emergency safety device providing a steady stream of water for flushing the eye. An eye cap is a thin plastic dome-shaped disc used to restore contour just beneath the eyelids. It's an aid in eye closure. Fat is an organic compound containing carbon, hydrogen, and oxygen, chemically a triglyceride ester composed of glycerol and fatty acids. Fat is a triglyceride ester composed of glycerol and fatty acids. It contains carbon, hydrogen, and oxygen. Who knew? Fatty acids is a product of decomposition of fats. Febrile is characterized by a high fever causing dehydration of the body. Fermentation is bacterial decomposition of carbohydrates. Fever blisters are lesions of the mucous membrane of the lip or mouth caused by herpes simplex type 1 or 2 virus or by dehydration of the mucous membrane in a febrile disease. Fever blisters. Firming. Firming is the rigidity of tissue due to chemical reaction. Firming is the rigidity of tissue due to chemical reaction. Don't mix that up with rigor. Fixation, the act of making tissue rigid, the solidification of a compound. Fixative, an agent employed in the preparation of tissues for the purpose of maintaining the existing form and structure. Many of agents are used, the most important one being formalin. Formaldehyde, HCHO, is a colorless, strong-smelling gas that when used in solution is a powerful preservative and disinfectant, a potential occupational carcinogen. Formaldehyde gray is gray discoloration of the body caused by the reaction of formaldehyde from the embalming process with hemoglobin to form methyl hemoglobin. Formaldehyde rule is the OSHA regulation limiting the amount of occupation exposure to formaldehyde gas. Furuncle is the same as boil. Furuncle is the same as boil. Gangrene is necrosis. It's death of tissues of part of the body, usually due to deficient or absent blood supply. Dry gangrene is a condition that results when the body part that dies had little blood and remains aseptic. The arteries, but not the veins, are obstructed. Moist or wet gangrene is necrotic tissue that is wet as a result of inadequate venous drainage, may be accompanied by bacterial infection. Gas gangrene is necrosis in a wound infected by an anaerobic gas-forming bacillus. The most common etiologic agent being Clostridium perfringens. Grave wax is the same as adipocere. Gravity filtration is extravascular movement of preservative fluids by gravitational force to the dependent areas of the body. Gravity injector is an apparatus used to inject arterial fluid during the vascular arterial phase of the embalming process. It relies on gravity to create the pressure required to deliver the fluid, which is 0.43 pounds of pressure for 1 foot of elevation. 0.43 pounds of pressure per 1 foot of elevation. Groove director is an instrument used to guide vein tubes into vessels. A hand pump is a historical instrument resembling a large hypodermic syringe attached to a bottle apparatus. Hard water is water containing large amounts of mineral salts. The water, which is the vehicle to be used in mixing vascular embalming solutions, needs to have these mineral salts removed or sequestered. Hardening compound is a chemical in powder form that has the ability to absorb and to disinfect, often used in cavity treatment of autopsied cases. Hazard communication standard hazard communication standard or rule is the OSHA regulation that deals with identifying and limiting exposure to occupational hazards. Hazardous material, an agent or material exposing one to risk. Headrest, piece of equipment used to maintain the head in the proper position during the embalming process. Hematemesis is blood present in vomitus or vomiting of blood. Hematoma is a swelling or mass of clotted blood confined to an organ or space caused by a ruptured blood vessel. Heme is the non-protein portion of hemoglobin, or the red pigment of hemoglobin is heme. Hemoglobin is the red respiratory portion of the red blood cells. Iron containing pigment of red blood cells functioning to carry oxygen to the cells. Hemolysis is destruction of red blood cells that liberates hemoglobin. Hepatitis is inflammation of the liver. Hepatitis is inflammation of the liver. It may be caused by a variety of agents, including viral infections, bacterial infections, and physical or chemical agents. It is usually accompanied by fever, jaundice, and an enlarged liver. Hepatitis B virus, or HBV, is a severe infectious blood-borne virus. Herpes is an inflammatory skin disease marked by small vesicles in clusters, usually restricted to diseases caused by the herpes virus. High preservation demand fluids is special vascular arterial fluid with an HCHO content of 25 to 36%. Household bleach is a 5% sodium hypochlorite solution. 12 ounces of household bleach with 116 ounces of water yields 1 gallon of a 10% household bleach solution. 5,000 ppm sodium hypochlorite. Human immunodeficiency virus, or HIV, is a type of retrovirus that causes acquired immunodeficiency syndrome, also known as AIDS. Human remains is the body of a deceased person, and it includes cremated remains. Humectant is a chemical that increases the ability of embalmed tissue to retain moisture. Hydroaspirator is an apparatus that is connected to the water supply. When the water is turned on, a suction is developed and is used to aspirate the contents of the body's cavities. Hydrocele is abnormal accumulation of fluids in a sac-like structure, especially the scrotal sac or nutsac. Hydrocephalus is abnormal accumulation of cerebrospinal fluids in the ventricles of the brain. Hydrolysis is a reaction in which water is one of the reactants and compounds are often broken down. In the hydrolysis of proteins, the addition of water accompanied by action of enzymes results in the breakdown of protein into amino acids. Hydropericardium is abnormal accumulation of fluid within the pericardial sac. Hydrothorax is abnormal accumulation of fluid in the thoracic cavity. Hygroscopic, hygro with a G, like a goat. Hygroscopic is absorbing moisture readily. Hypertonic solution is a solution having a greater concentration of dissolved solute than the solution to which it is compared. Hypodermic embalming is the injection of embalming chemicals directly into the tissues through the use of a syringe and needle or a trocar. Hypostasis is the settling of blood and or fluids to dependent portions of the body. Hypotonic solution is a solution having a lesser concentration of dissolved solute than the solution to which it is compared. Imbibition is the absorption of fluid portion of blood by the tissues after death, resulting in post-mortem edema. Imbibition. It's two B's like Bravo. Imbibition. Incision is a clean cut made with a sharp instrument. In embalming, a cut made with a scalpel to raise arteries and veins. Index is the strength of the embalming fluids indicated by the number of grams of pure formaldehyde gas dissolved in 100 milliliters of water. Index refers to a percentage. An embalming fluid with an index of 25 usually contains 25% formaldehyde gas. Infant is a child less than 1 year of age. Infectious disease is a disease caused by the growth of a pathogenic microorganism in the body. Infectious waste is the same as biohazard. Inferior, from a given reference toward the feet. Inguinal ligament is an anatomical structure forming the base of the femoral triangle, and it extends from the anterior superior iliac spine to the pubic tubercle. Injection is the act or instance of forcing a fluid into the vascular system or directly into the tissues. Injection pressure is the amount of pressure produced by an injection device to overcome initial resistance within intravascular or on extravascular vascular system, arterial or venous. The amount of pressure produced by an injection device to overcome initial resistance within or on the vascular system, which could be intravascular, extravascular, arterial, or venous. Instantaneous rigor mortis is the immediate stiffening of the muscles of a dead human body. Intercellular is between the cells of a structure. Intercellular fluid is fluid inside cells of the body, constituting about 1/2 of the body weight. Intercostal space is the space between the ribs. Intermittent drainage or restricted drainage is a method of drainage in which the drainage is stopped at intervals while the injection continues. Interstitial fluid is fluid in the supporting connective tissues surrounding body cells, about 1/5 the body weight. Intravascular is within the blood vascular system. Intravascular blood discoloration is discoloration of the body within the blood vascular system, for example, hypostasis, carbon monoxide, and capillary congestion. Intravascular fluid is fluid contained within vascular channels, about 1/20th of the body weight. Intrinsic means from within the body. Isotonic solution, a solution having an equal concentration of dissolved solute to that of a standard of reference. Jaundice, conditions characterized by excessive concentrations of bilirubin in the skin and tissues and deposition of excessive bile pigment in the skin, cornea, body fluids, and mucous membranes, with the resulting yellow appearance of the patient. Jaundice fluid is a special vascular fluid with special bleaching and coloring qualities for use on bodies with jaundice, usually have a low formaldehyde content. Laceration is a wound characterized by irregular tearing of tissue. Irregular is a laceration. Larvicide is a substance used to kill insect larvae. Lateral means away from the midline. Legionnaire's disease is a severe, often fatal bacterial disease characterized by pneumonia, dry cough, and sometimes gastrointestinal symptoms. Lesion, any change in structure produced during the course of a disease or injury. Ligate means to tie off an artery and vein upon completion of embalming. Linear guide is a line drawn or visualized on the surface of the skin to represent the approximate location of some deeper lying structure. Lipolysis, decomposition of fats. Livor mortis, also called cadaveric lividity, is the post-mortem intravascular red-blue discoloration from hypostasis of blood. Livor mortis, cadaveric lividity. Lumen, the cavity or opening of a vein, artery, or intestine. Lysine is a specific antibody acting destructively upon cells and tissues. Lysine. Lysosome is an organelle that exists within a cell, but separate from the cell, contains hydrolytic enzymes that break down proteins and certain carbohydrates. Maggot is an insect larva, especially flies. Mandibular suture is a method of mouth closure in which a suture is passed through the septum of the nose and around the mandible. Masking agent is also perfuming agents. Massage is the manipulation of tissue in the course of preparation of the body. Medial means towards the midline. Medical examiner is an official elected or appointed to investigate suspicious or unnatural deaths. Meningitis, inflammation of the meninges. Microbe or microorganism is a minute one-celled life form, not distinguishable as to vegetable or animal nature. Mid-axillary line is a vertical line drawn from the center of the medial border of the base of the axillary space. Millicurie, MCI, is that amount of radioactive material in which 37 million atoms disintegrate each second. Modifying agent is a chemical added to the embalming solution to deal with varying demands predicated upon the type of embalming, the environment, and the embalming fluid to be used. Mold preventative is those agents which will prohibit the growth of mold. Moribund, in a dying state in the agonal period, is moribund. Mortuary putty is a paste to fix or fill. A mouth former is a device used in the mouth in shaping the contour of the lips. Material Safety Data Sheet, MSDS. This must accompany a hazardous product, a requirement of the Department of Labor and OSHA under the Hazard Communication Standard. Material Safety Data Sheet. Multiple site injection or multi-point injection is a vascular injection from 2 or more arteries. A minimum of 2 sites is prescribed in the suggested minimum standard for embalming. Musculature suture is a method of mouth closure in which a suture is passed through the septum of the nose and through the mentalis muscle of the chin. Nasal cavity is a space between the roof of the mouth and the floor of the cranial cavity. Nasal tube aspirator is an embalming instrument used to aspirate the throat by means of the nostrils. Necrobiosis is an ante-mortem physiological death of the cells of the body followed by their replacement. Necropsy is the same as autopsy. Necrosis is the pathological death of a tissue still a part of the living organism. Needle injector is a mechanical device used to impel specifically designed metal pins into bone. Nephritis is inflammation of the kidneys. Nitrogenous waste is metabolic byproducts that contain nitrogen, such as urea and uric acid. These compounds have a high affinity for formaldehyde and tend to neutralize embalming chemicals. Non-cosmetic fluid is a type of arterial fluid which contains inactive dyes that will not impart a color change upon the body tissues of the deceased. Occupational exposure is reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials that may result from the performance of a worker's duties. Occupational Safety and Health Administration, OSHA, is a governmental agency with the responsibility for regulatory and enforcement of safety and health matters for most United States employees. An individual state OSHA agency may supersede the U.S. Department of Labor OSHA regulations. State may supersede U.S. Department of Labor. One-point injection is injection and drainage from one location. Operative corrections is any and all techniques to treat a problem area, like excision, incision, or wicking. Is operative corrections. Ophthalmoscope, OPHTH, ophthalmoscope is an optical instrument with an accompanying light that makes it possible to examine the retina and to explore for blood circulation. Optimum is the most favorable condition for functioning. Oral cavity is the mouth and the vestibule, or the opening to the throat. Osmosis is the passage of solvent from a solution of lesser to one of greater solute concentration when the two solutions are separated by a semi-permeable membrane. Packing forceps are embalming instruments used in filling the external orifices of the body. Palpate means to examine by touch. Parallel incision is an incision on the surface of the skin to raise the common carotid arteries. It is made along the posterior border of the inferior 1/3 of the sternocleidomastoid muscle. Parallel incision. So it's like running parallel to the sternum. No. Yeah. Okay, whatever. I don't know. Made along the posterior border of the inferior 1/3 of the sternocleidomastoid muscle. Parallel incision. Parenteral means piercing mucous membranes or the skin barrier through such events as needle sticks, human bites, cuts, and abrasions. Parenteral, human bites. Parts per million, ppm. In contaminated air, the parts of vapor or gas, formaldehyde per million parts of air by volume. In solution, the parts of chemical per million parts of solution. Personal protective equipment, PPE, is specialized in clothing or equipment worn by an employee for protection against a hazard. Pathological discoloration is antemortem discoloration that occurs during the course of certain diseases like gangrene and jaundice. Pediculicide is a substance able to destroy lice. Pediculicide destroys lice. Percuteness is affected through unbroken skin. Perfuming agents or masking agents are chemicals found in embalming arterial formulations having the capability of displacing an unpleasant odor or of altering an unpleasant odor so that it is convened to a more pleasant one. Perfusion is to force a fluid through an organ or tissue, especially by way of the blood vessels. Injection during vascular arterial embalming. Peritonitis is inflammation of the peritoneum, the membranous coat lining the abdominal cavity and investing the viscera. Permissible exposure limit, or PEL, is the maximum legal limits established by OSHA for regulated substances. These are based on employee exposure that are time-weighted over an 8-hour work shift. When these limits are exceeded, employers must take proper steps to reduce employee exposure. For formaldehyde, the PEL is 0.75 ppm. Personal protective equipment, or PPE, are those items of protection worn to minimize exposure to hazards, those items worn by the embalmer to avoid contact with blood and other body fluids. Petetia is antemortem pinpoint extravascular blood discoloration visible as purplish hemorrhages of the skin. Pharmaceutical agents are drugs or medicines. Pitting edema is a condition in which interstitial spaces contain such excessive amounts of fluid that the skin remains depressed after palpation. Positioning devices are preparation room equipment for properly positioning bodies prior to, during, and after vascular embalming. Posterior means towards the back. Post-mortem is the period that begins after somatic death. Post-mortem caloricity is the rise in temperature after death due to continued cellular metabolism. Post-mortem examination is the same as autopsy. Post-mortem physical changes is a change in the former state of matter without any change in chemical composition. Post-mortem stain is extravascular color change that occurs when heme is released by hemolysis of red blood cells and seeps through the vessel walls and into the body tissues. Postmortem stain, Hemi. Potential of hydrogen, pH. Degree of acidity or alkalinity. The scale ranges from 0 to 14, 0 being completely acid, 14 completely basic, and 17 neutral. Blood has a pH of 7.35 to 7.45. Potential pressure is the pressure indicated by the injector gauge needle when the injector motor is running and the arterial tubing is clamped off. It says Turner Portaboy injection machine. Potential pressure, injector gauge needle, motors running, arterial tubes clamped off. Precipitant, a substance bringing about precipitation. The oxalates formerly used in water conditioning chemicals are now illegal because of the poisonous nature to the embalmer. So I guess they bring about precipitation. Pre-injection fluid is fluid injected primarily to prepare the vascular system and body tissues for the injection of the preservative vascular arterial solution. The solution is injected before the preservative vascular solution is injected. Preparation room, that area or facility wherein embalming, dressing, cosmetizing, or other body preparation are affected. Preservation, see temporary preservation, is the science of treating the body chemically so as to temporarily inhibit decomposition. Preservative is chemicals which inactivate saprophytic bacteria, render unsuitable for nutrition the media upon which such bacteria thrive, and which will arrest decomposition by altering enzymes and license of the body, as well as converting the decomposable tissue to a form less susceptible to decomposition. Preservative demand is the amount of preservative formaldehyde required to effectively preserve and disinfect remains. Depends on the condition of the tissues as determined in the embalming analysis. Preservative powder, chemical in powder form, typically used for surface embalming of the remains. Pressure, the action of a force against an opposing force, a force applied or acting against resistance. Actual pressure is that pressure which is indicated by the injector gauge needle when the arterial tube is open and the arterial solution is flowing into the body. Blood pressure is the pressure exerted by the blood on the vessel walls measured in millimeters of mercury. Differential pressure is the difference between potential and actual pressure. Injection pressure is the amount of pressure produced by an injection device to overcome initial resistance within intravascular or extravascular on the vascular system. Injection pressure, the amount of pressure produced by an injection device to overcome initial resistance within or on the vascular system, which could be intravascular, extravascular, arterial, or venous. Intravascular pressure, pressure developed as the flow of embalming solution is established and the elastic arterial walls expand and then contract, resulting in filling of the capillary beds and development of pressure filtration. Potential pressure, the pressure indicated by the pressure Potential pressure, the pressure indicated by the injector gauge needle when the injector motor is running and the arterial tubing is clamped off. Pressure filtration is positive intravascular pressure causing passage of embalming fluid through the capillary wall to diffuse with the interstitial fluids. causing passage of embalming fluid from an intravascular to an extravascular position. Primary dilution is the dilution attained as the embalming solution is mixed in the embalming machine. Primary disinfection is disinfection carried out prior to the embalming process. Primary disinfection is prior to the embalming process. Procurement, the recovery of organs or tissues from a cadaver for transplantation purposes. Prognathism is the projection of the jaw or jaws that may cause problems with mouth closure and alignment of the teeth. Protein is organic compound found in plants and animals that can be broken down into amino acids. Proteolysis is decomposition of proteins. Ptomaine, Ptomaine, PTO in Maine, paid time off in Maine, right? Okay. Any one of a group of nitrogenous organic compounds formed by the action of putrefactive bacteria on proteins, indole, scatole, cadaverine, and putrescine. Ptomaine, ptomaine, whatever. Pubic symphysis, the fibrocartilage that joins the two pubic bones in the median plane. Purge, post-mortem evacuation of any substance from an external orifice of the body as a result of pressure. Pustular, pus, liquid product of inflammation containing various proteins and leukocytes. Pustular lesion is characteristic pus-filled structure of a disease such as smallpox, syphilis, and acne. Putrefaction is decomposition of proteins by the action of enzymes from anaerobic bacteria. Radiation protection officer is the supervision in an institution licensed to use radionuclides that has the responsibility to establish procedures and make recommendations in the use of all radioactive mailer. I thought that was a typo. I thought it meant matter. No, radioactive mailer. Like, who the fuck comes up with this shit? Mailer. Radionuclide, a chemical element that is similar in chemical properties to another element, but differs in atomic weight and electric charge and emits radiation. An atom that disintegrates by emission of electromagnetic radiation. Rate of flow, speed at which fluid is injected, measured in ounces per minute. Razor burn, razor abrasion, a mark of desiccation, which desiccation is also dehydration. Reaspiration, repeated aspiration of a cavity. Reducing agent, substance that easily loses electrons and thereby causes other substances to be reduced. Formaldehyde is a strong reducing agent, makes things lose electrons, reduces electrons. Resinous substance is an amorphous, non-volatile solid or soft side substance, a natural exudation from plants. Any of a class of solid or soft organic compounds of natural or synthetic origin. Restrictive drainage is intermittent or alternate injection and drainage. Restoration is treatment of the deceased in an attempt to recreate natural form and color. Restorative fluid, also called a humectant, is a supplemental fluid used with the regular arterial solution, whose purpose is to retain body moisture and retard dehydration. Restricted cervical injection is a method of injection wherein both common carotid arteries are raised. Right Atrium is the right side of the heart, seen as the center of drainage, used as a site of drainage via instruments from the right internal jugular vein and direct via the trocar or through the thoracic wall. Right atrium, center of drainage. Instruments from the right internal jugular vein hit the right atrium. Trocar gets it through the thoracic wall. Rigor mortis is post-mortem stiffening of the body muscles by natural body processes. Saccharolysis is decomposition of sugars. Sanitation, a process to promote and establish conditions which minimize or eliminate biohazards. Saponification is the process of soap formation as related to decomposition, the conversion of fatty tissues of the body into a soapy, waxy substance called adipocere or grave wax. Saponification. Saprophytic bacteria is bacteria that derive their nutrition from dead organic matter. Scalpel, a two-piece embalming instrument consisting of a handle and a blade used to make incisions and excisions. Scalpel is two-piece. Bestiary is one piece. Scalpel is two-piece. Bestiary is one piece. Sealing agents. Material used to provide a barrier or seal against any type of leakage or of fluid or blood. Secondary dilution is the weakening of the embalming fluid by the fluids in the body, both vascular and interstitial. Sepsis is a pathological state resulting from the presence of microorganisms or their products in the blood or other tissues. Septicemia is a condition characterized by the multiplication of bacteria in blood. Sequestering agent is a chemical agent that can fence off or tie up metal ions so they cannot react with other chemicals. Sequestering agents are also called serrated, I guess. It just says serrated, like one sentence, one word. Notched on the edge like a saw as seen with forceps. I don't know what the fuck. But it has to do with sequestering agents with tying up metal ions. Sharps, hypodermic needles, suture needles, injector needles, scalpel blades, razor blades, pins, and other items sharp enough to cause percutaneous injury, penetration of unbroken skin, may include other items normally not disposed of following use, such as scissors, teeth, fingernails, and ribs. Teeth, fingernails, and ribs are also sharps. Sharps container, OSHA required receptacle for proper disposal of sharps. Short-term exposure limit, STEL, is the legal limits established by OSHA to which workers can be exposed continuously for a short period of time without damage or injury. Exposures at the STEL should not be for more than 15 minutes and not repeated more than 4 times per workday. Sign of death, manifestation of death in the body. Sodium hypochlorite is an unstable salt usually produced in an aqueous solution and used as a bleaching and disinfecting agent. Solute, the substance that is dissolved in a solution. Solution is liquid containing a dissolved substance. Solvent is a liquid holding another substance in the solution. Solute, solution, solvent. I'm going to repeat that. Solute is the substance that is dissolved in a solution. Solution is the liquid containing the dissolved substance. Solvent is a liquid holding another substance in the solution. Somatic death is the death of the organism as a whole. Somatic death is the death of the organism as a whole. Split injection is injection from one site and drainage from a separate site. Sterilizers, oven or appliance for sterilizing, an autoclave that disinfects by steam under pressure at temperatures above 100 degrees Celsius. Sterilization, process that renders a substance free of all microorganisms. Stethoscope is a delicate instrument used to detect almost inaudible sounds produced in the body. Stillborn means dead at birth, a product of conception, either expelled or extracted dead. Subcutaneous, situated or occurring beneath the skin. Subcutaneous emphysema, distension of the tissues beneath the skin by gas or air, an antemortem condition brought about by a surgical procedure or trauma. Superficial means toward the surface. Superior means anatomically towards the head. Supplemental fluid is fluid injected for purposes other than preservation and disinfection. Supplemental fluids generally fall into one of three categories: pre-injection, co-injection, and humectants or restorative fluids. Surface compress, cloth, wet or dry, folded and applied firmly to a body part. Surface embalming is the direct contact of body tissues with embalming chemicals. Surface discoloration is a discoloration due to the deposit of matter on the skin surface. These discolorations may occur ante-mortem, during, or after embalming of the body. Adhesive tape, ink, iodine, paint, and tobacco stains are surface discolorations. Surface pack is an absorbent material compress saturated with an embalming chemical and placed in direct contact with the tissue. Surfactant is a surface tension reducer, a wetting, penetrating, or surface active agent, a chemical that reduces the molecular cohesion of a liquid so it can flow through smaller apertures. Surfactant. Temporary preservation is the science of treating the body chemically so as to temporarily inhibit decomposition. Terminal disinfection is institution of disinfection and decontamination measures after the preparation of the remains. So terminal disinfection is after the preparation of the remains. Primary is before. Test of death is any procedure used to prove a sign of death. Thanatology is the study of death. Third-degree burns is the destruction of cutaneous and subcutaneous tissues, seared, charred, or roasted tissue. Roasted? Really? They had to say roasted. Tissue coagulation is a general term. It's the solidification of a sol or solution into a gelatinous mass. Agglutination is a specific form of coagulation. Tissue gas, post-mortem accumulation of gas in tissues or cavities brought about by an anaerobic gas forming bacillus, Clostridium perfringens. Anaerobic gas. Tobacco tars, the yellowing, browning of the fingernails and fingers from excessive use of cigarettes, a surface discoloration. Topical disinfection is disinfection of the surface of a body or an object. Surface is topical. Translocation is an agonal or post-mortem redistribution of host microflora on a host-wide basis. Translocation is an agonal or post-mortem redistribution of host microflora on a host-wide basis. Transplantation is the grafting of living tissue from its normal position to another site, or of an organ or tissue from one person to another. Transverse is lying at right angles to the long axis of the body. Trauma is a physical injury or wound caused by external force or violence. Trocar is a sharply pointed surgical instrument used in cavity embalming to aspirate the cavities and inject cavity fluid. The trocar may also be used for supplemental hypodermic embalming. Trocar button, a plastic threaded screw-like device for sealing punctures in small round trocar openings. Trocar guide is a line drawn or visualized on the surface of the body or a prominent anatomic structure used to locate internal structures during cavity embalming. From a point of reference, 2 inches to the left and 2 inches superior to the umbilicus. Trocar guide, point of reference, 2 inches to the left and 2 inches superior to the umbilicus for the trocar guide. Time-weighted average, TWA, is an evaluation of exposures that are time-weighted over an established period. It allows the exposure levels to be averaged generally over an 8-hour time period. Unional, plastic garment designed to cover the entire body from the chest down to and including the feet is a unional. Covers the entire body. Remember, the coverall is for us. The unional is for the body. Universal precautions is an approach to infection control. According to the concept of universal precautions, all human blood and certain human body fluids are treated as if known to be infectious for HIV, HBV, and other bloodborne pathogens. Vacuum breaker is an apparatus that prevents the back siphoning of contaminated liquids into potable water supply lines or plumbing cross connections within a preparation room. Vascular arterial embalming is the use of the blood vascular system of the body for temporary preservation, disinfection, and restoration. Accomplished through injection of embalming solutions into the arteries and drainage from the veins. Vehicle is liquids that serve as a solvent for the numerous ingredients that are incorporated into embalming fluids. It's only water and alcohol. Viscosity is the resistance to the flow of a liquid or the thickness of a liquid. Water conditioner is a complexing agent to remove chemical constituents from municipal water supplies that could interfere with drainage and preservation. Water hardness is the quality of water containing certain substances, especially soluble salts of calcium and magnesium. Waterlog, that's a condition. Waterlog is a condition resulting from the use of an embalming solution containing an insufficient amount of preservative to meet the preservation demand of the tissues. The interstitial spaces are overly filled, engorged with water, waterlogged. Wet gangrene is necrotic tissue that is moist as a result of inadequate venous drainage, may be accompanied by bacterial infection. A wetting agent is the same as a surfactant, breaks up the cohesion on the surface of the water or something. Work practice controls are controls that reduce the likelihood of exposure by altering the manner in which a task is performed. As example, prohibiting the recapping of needles and not allowing blood splatter or aerosolization of blood while draining during the embalming process. Work practice controls. And finally, a list of acronyms. ACGIH, American Congress of Governmental Industrial Hygienists. AIDS, Acquired Immune Deficiency Syndrome. AL, Action Level. BCME, Bischloromethyl ether. CDCP, Centers for Disease Control and Prevention. ECG, electrocardiogram, also EKG. EEC, electroencephalogram. EPA, Environmental Protection Agency. FTC, Federal Trade Commission. HBV, hepatitis B virus. HCHO, formaldehyde. HIV, human immune deficiency virus. MCI, millicurie. MSDS, material safety data sheet. NIOSH, National Institute for Occupational Safety and Health. OPIM, other possibly infectious material. OSHA, Occupational Safety and Health Administration. PEL, permissible exposure limit. pH, potential of hydrogen, acid, base, or neutral. pH, potential of hydrogen. PPE, personal protective equipment. PPM, parts per million. STEL, STEL, short-term exposure limit. And TWA, time-weighted average. And that ends the glossary. Finally,